There's definitely a point where you're just like, I'm going to have to live like this forever.
I've been on antidepressants since I was 13 and never really got away from depression.
Spravato has become a big success for Johnson & Johnson.
The patient will feel sleepy, they will feel as though they're floating, they can feel detached from themselves. That's the physical part of this treatment. The patient's psychological response differs, and there's very few things I can do to prepare patients for that part of the experience. It's really interesting because science has still not yet proven whether or not that psychological experience is tied to the outcome.
The more time that you live with depression, the harder it becomes. My particular diagnosis was treatment-resistant depression. That's a terrible thing to have.
What drew me to this story initially is the fact that Spravato is a drug that not a lot of people actually know about. Spravato is a nasal spray treatment for people with treatment-resistant depression, those people who have tried other depression treatments and haven't had much success.
S-ketamine has been tested through rigorous 7 pivotal trials now and has been FDA approved for treatment-resistant depression, major depressive disorder with acute suicidal ideation and behavior.
Johnson & Johnson pays Harding to speak on panels around the world to educate others about Spravato. Johnson & Johnson took a pretty conservative approach to launching the medication because this was a completely new kind of medication that was really different from any other depression treatments that came before it. J&J wanted to be really careful about the way that they were getting it out to patients, especially because ketamine itself had an addictive potential. What they did at first was they targeted larger university medical systems that had larger established psychiatric practices within them, but that actually isn't where a lot of people were seeking out depression treatment. People were going to their psychiatrist's offices. Most patients with depression are used to picking up a pill or a treatment from their pharmacy and just taking it at home. But with Spravato, it was a completely different model. Patients actually had to go in person to a clinic or to a center to get this drug administered to them, and then they needed to stay there for a couple of hours after for monitoring. Spravato's sales have more than doubled since 2023, and Wall Street expects the drug to generate more than $2.3 billion for J&J this year. J&J is the only maker of an approved ketamine derivative for now, but other companies are dipping their toes into psychedelic adjacent therapies. AbbVie bought the rights to a similar depression treatment last year.
If I were, for example, going to consent you to this treatment, I have to tell you the risks, I have to tell you the possible benefits, I have to tell you about the alternatives, and I have to tell you about what would happen if you got no treatment at all. The immediate effect, the onset, is within the first 5 to 10 minutes. The patient will feel sleepy, they will feel as though they're floating, they can feel detached from themselves. We monitor pulse oximetry and their blood pressure. We screen appropriate patients. If I have 100 patients signing up for a consultation, the appropriate number of them would just be a third because that's treatment-resistant depression. The patient has to have pretty strict parameters.
Number 2.
For the first couple of years, it wasn't incredibly popular. That, combined with the pandemic, when all the in-person care was halted, made it really difficult at the beginning for this drug to take off. At first, there was some hesitancy and concern, as there is sort of with any new modality, but over time, clinics started figuring out how to actually make the economics of this drug work.
The providers that refer the patients want to know, do we stop this treatment? When to stop? I actually just had a referral for a patient that is 62 years old that has been on another medication for 25 years. Never has anyone asked that patient or the provider, when do you stop this? I want the perception to change. I want psychiatric patients to be treated like they had cancer. We're not starting with the treatment that's going to take you 4 to 6 weeks. We're being aggressive in treating our patients because we want to get them to remission.